gentlemen. Today I'm going to talk about placement-based learning at the Leicester School of Pharmacy. My main focus is going to be on community pharmacy placements because that is what I organise. However, quite a lot of the stuff that I'm going to mention can also be linked in with hospital pharmacy, no doubt. So the overall aim of my talk today is really to give you an overview of the undergraduate community pharmacy placements or visits scheme here at the Leicester School of Pharmacy, with a view really to increase working partnerships with more of yourselves. So it's a bit of a recruitment programme as well, to try and get more, particularly community pharmacists, on board to help us with some of these placements. It's already been mentioned about the pharmacy white paper, Pharmacy in England, and we've had quite some debate about the community, the extended range of services, etc., that this paper is advocating. Therefore, the greater clinical and public health responsibilities that are coming up for pharmacists, community pharmacists, and all other branches of pharmacy. And you're probably all aware of the Modernising Pharmacy Careers Programme or board, which is kind of overseeing some of the changes that are going to happen in pharmacy careers. I just mentioned this white paper because it does have a lot of implications for pharmacy education in this country. And looking at it from my point of view in terms of placements, there is going to be a greater emphasis on work shadowing and placements within the MPharm, and there's obviously quite a lot of talk and debate currently about the integrated degree, possibilities of that. And whatever, in my opinion, and it's shared by quite a lot of people, that whatever happens, maintaining the science base of education is very important. So the science and the practice, you can't have one without the other. So that's very important. Some of the advantages of placement-based learning or workplace-based learning are some of the things that are written up there. We're all aware of most of these. Linking in science, theory and practice, and students actually gaining very, very valuable experience of the real work environment. It facilitates reflective practice, and I think it early on established professional identity in young up-and-coming pharmacy students, promotes professionalism to be in a working environment, and obviously builds confidence in people if they can put some of the things that they've learnt at university into practice, test them out, get feedback, etc. So it builds up your confidence. On the other hand, it's well established that placement-based learning may not work very well if it lacks clear objectives and structure. You can't just send a student in if he or she doesn't know what they're doing, and the mentor, i.e. the host pharmacist, and their team really don't have a clue either. If it's just an observation, a passive observation, our placements are observatory, but they're not passive observation. You can't just sit a person on a stool and say, that's it, 3 hours. They will just nod off, obviously, after the first 20 minutes or so, if that. If the environment is too busy, a very busy pharmacy, if you're short-staffed, if there is lack of support from the pharmacy team, and the placement may be too short, there may not be enough time for reflection, discussion. All those things can have a negative impact on the learning experience for the student. If the students can't see, the last point there, where the placement comes within the curriculum, that's another point as well. Some students have said, for example, well, where does this link in? How does this link in? So that it's important that it's integrated within the MPharm. So on this slide, really, I'm just kind of showing you where the placements fall and have fallen over the past couple of years or so within our MPharm at Leicester. The main thing I want to just point out here is that in the last academic year, we've increased our community pharmacy placements a little bit by another 3 hours, and we've got a significant number of hours here through the community pharmacy option as well. So before that, we didn't have really much, and it was very much hospital-based. And when you compare that with other schools of pharmacy, well, you know, some schools of pharmacy have got similar sorts of patterns. Some of them are perhaps quite community pharmacy based, for example Bradford, with quite a comparatively low amount of hospital placements. So, you know, it's getting the balance right, I suppose, and that's quite important. So for us, we needed to increase the amount of community pharmacy placements from our student point of view, as well as other factors. It's important, you know, as I mentioned, that people know what they're doing, the students know what they're out to achieve, and the mentors or the host pharmacists and their team are aware as well. Overall, all our placements have got these general learning outcomes to gain an insight into the working practices of the pharmacy, to be able to relate the theory that they've learnt at university to practice, to be able to reflect on what they've seen and think about its impact on patient care, to be able to think about how is it going to affect me developing as a pharmacist, how can I change my practice or improve my practice, so that I come out as a pharmacist who, you know, is patient-centred, etc., and to be able to appreciate professionalism as it applies to pharmacy. So that's, you know, that's our overall learning outcomes, and within each of the placements in the first, second and final year, the placements themselves have got a particular theme as well as having those general learning outcomes. So the first year placements are based on clinical governance, the second year on responding to symptoms, and then the fourth year optional placements have got all sorts of different themes. And I mentioned about observation, so it's not just passive observation, there's a lot of investigation, questioning and role play, and that's the main way in which our students are going to fulfil their learning outcomes. Our studies have shown that I've undertaken with our students really, almost 2/3 of the students that would come to your pharmacy, for example, would be hopefully asking you a question. These also, the placements do form part of an assessment, and they're all assessed through either a reflective portfolio or a reflective essay. So, you know, reflection and reflective learning is quite a key element within the placements.